Exercise-Induced Asthma, An Athlete's Guide. Written by Oman Evans. Edited by Bryce Herman. Read by Christian Neele. Preface. Professional background. The author is a practicing allergist, currently in drug research and development. He has counselled hundreds of patients individually and regrets the minimal awareness there is on the topic. Reason for the book. This book is written to be educational. I write with the presumption that you are an athlete seeing a doctor about shortness of breath, coughing, and fatigue during exercise. If you are not, I certainly encourage you to see a healthcare professional. This book is what you might hear if you were able to have a 60-minute appointment with an allergist or pulmonologist. I will tell you that if you have ever needed to go to an emergency room for breathing issues, even if it was for the flu, you potentially have more than EIB. Introduction. You are young, strong, and in the best shape you have ever been. So why do you seem to struggle to breathe after a workout, practice, or exercise? Do you think it is normal to cough after a run? Why is it worse in the cold? Maybe you think you need to focus more on technique or train harder or learn how to breathe better. But the harder you train, the more prominent the symptoms are. Perhaps you even suspected you have asthma and went to the doctor to be tested only to be told there is nothing wrong. The fact is, many aerobic athletes have exercise-induced bronchospasm, EIB. Technically, it is a form of asthma, but there are many important differences than typical asthma. Firstly, it is a low-risk condition compared to severe, persistent asthma, and therefore most medical professionals won't bother studying or talking about it. We will discuss that later. If you have EIB, often called exercise-induced asthma, you are not alone. Olympic medalists in figure skating, cross-country skiing, and ice hockey also battle with exercise-induced bronchospasm, EIB. Fit swimmers have the highest prevalence of EIB. Despite not being high risk, it can have a significant impact on athletic performance, career goals, lifestyle, and military eligibility if its effects are not mitigated. Thinking of EIB as typical asthma may lead to no diagnosis ever made. EIB is not detected with a methacholine test. Negative stigma. In reality, EIB can be a marker of an elite athlete. Under treatment. EIB may need high-dose medication.
Sample complete. Ready to continue?